Hi, this is Mark Adajar. I'm one of the XSculpt doctors and surgeons of XSculpt, and I'm here in one of the operating rooms at our XSculpt headquarters in Evanston, Illinois, and I wanted to talk today about a topic that's pretty common, and it's about how depression and low testosterone are very similar in symptoms, and people are often misdiagnosed with having depression when in actuality they have low testosterone levels. So to start, let's talk about the whole depression prescription epidemic. So over the past 15 years, there's been a 65 increase in the prescription or I should say the prescribing of antidepressant medication. Now currently they estimate 1 in every 8 people are on some sort of antidepressant medication. Most of these are women. Women actually are 2 times likely as men to be on some sort of antidepressant medication, and this information comes from this report given by the CDC, the Centers of Disease Control, in August of 2017. And so it is a big epidemic. You know, a lot of times people are prescribed antidepressant medication when in actuality they don't have depression. And a lot of this is because of, you know, over the past several years, increased amount of stress that people have become less able to handle, can lead to these symptoms. The direct company to consumer marketing by the drug companies have also increased this pressure of docs sometimes to prescribe their patients medications. So basically what happens is that a person will go to their primary care doctor and they'll complain of, you know, I'm feeling fatigued, I am gaining weight, I don't know why, I just am tired all the time, I have a lack of energy, I just, you know, I don't feel like as ambitious as I used to when I was younger. Which are very common complaints in stressed out individuals, middle age, as they get older. Those are very common complaints. The problem is those are the exact same symptoms as low testosterone. As if you watch my previous videos, low testosterone starts to decrease on an average of 1 to 3% after the age of 25 in women and after the age of 30 in men. And so the symptoms of fatigue, lack of ambition, lack of energy, weight gain, loss of muscle mass, lack of drive, sexual dysfunction, those are also symptoms of low testosterone. So when a person goes to their doc and they tell them that they have these symptoms, a lot of doctors will just go ahead and prescribe antidepressant medication without doing any type of hormone evaluation. You know, and not to blame the doctors. Doctors are very good out there. Of course, I myself are a doctor. The issue is that like testosterone replacement therapy or low or hormonal imbalance is not a subject that is well taught in medical school or in residency training. It's a very specialized field. So your standard doctor may not be very well trained to recognize these symptoms. Another thing is that insurance companies don't usually cover low testosterone unless it's at extremely low level and there is some sort of documentation of actually some sort of usually sexual dysfunction as a result of it. So it is extremely hard to get covered by insurance, and because it's not covered by insurance, there is no real drive or push for a doctor to diagnose it, because they're very limited in how they can treat it because it's not covered by insurance. And so as a result, docs, your typical primary care doctor may not be very well versed on the symptoms of low testosterone, but I encourage you to do your own research. Is that if you Google the symptoms of low testosterone, you Google the symptoms of depression, you'll see that the symptoms are almost identical. The point of this whole video is if you are feeling symptoms of depression or have been diagnosed with depression, I do encourage you to get your testosterone levels checked, because if your testosterone levels are low and you're put on depression medication, you may not feel better on that medication. And so I can't stress enough that before you start, or if you're already on depression medication, to get your levels checked so that the underlying cause of why you're feeling so horrible can be appropriately addressed. Don't get me wrong, depression is a very serious disease and it does happen out there. And of course, if you are diagnosed with depression, truly diagnosed with depression, absolutely you should be treated for it. I just want to make sure that you're being treated for the right thing, and not just put under this whole umbrella of you're feeling fatigued, you're not sleeping well, it must be depression, let's put you on antidepressant medication. Here at XSculpt, many of our patients who come in on some sort of antidepressant medication are no longer on them because they were misdiagnosed, and they're feeling wonderful. We can help you. So if you're in the Chicago area, please come in to get your testosterone levels checked, and we can help you. Otherwise, if you're beyond our reach, maybe inquire your own doctor, or maybe you can find a specialist in your area who can help. Thank you so much for listening. Click subscribe if you want more of our videos, and we hope to see you soon. Have a great day.